Hello everyone, I'm Louis Hubert and I'm going to be speaking about sexual masochism disorder, which forms part of the paraphilic disorders. So what actually is sexual masochism disorder, also known as SMD? Well, it's time to put the DSM and BDSM. It's characterized by an intense and recurrent sexual arousal from being made to suffer. This includes acts such as being beaten, humiliated, or bound. Diagnostic criteria continue and they say that the individual may have urges, fantasies, or take part in these activities, and that it must cause clinically significant distress or impairment to the individual. These events of arousal must be intense and recurrent for at least 6 months. There's a few specifiers as well, suggesting that it could take place in a controlled environment where sexual activities of the person are restricted, such as in an institution. It could be in full remission, when there's no distress or impairment due to the disorder for at least 5 years. Or it could be with fixophilia, which induces arousal from having the airflow restricted. This could be by paper bags or rope, for example. So should a psychologist be looking to make a diagnosis of SMD, there's a few things that they should probably consider first. Firstly, how long their client has actually had the disorder. So if they start saying things like, I've had these interests as long as I can remember, for example. So the psychologist might ask questions about their childhood and if trauma took place, various, cases of abuse possibly. It's important to note that those who are sexually submissive also tend to have more psychological difficulties, such as anxiety, low self-esteem, and those who are dominant seem to have less of those problems. The diagnosis of full remission, as mentioned earlier, does not mean the resolution of sexual masochistic interests, instead more referring to just not having distress or impairment due to them rather. There are also a number of dangers associated with SMD. Among this include an association of shame and guilt due to stigma, which could create ideas of suicide. Though the other side of this is also the dangers in autoerotic deaths. So people may often use plastic bags, ropes, or chemicals and then die to asphyxiation. Patients may also not be strictly masochistic or submissive. They may call themselves a switch if they are both. Sexual acts of masochism within mutual consent and without distress cannot be diagnosed as a disorder. Also, non-consensual acts are forms of sexual violence or assault, which is an extremely important factor to consider. And so we get on to quite the interesting topic of what it actually means to be someone with SMD. Well, first of all, they probably have quite the complicated life, specifically their sex life and social life. They may make excessive use of pornography depicting masochistic acts, and for the most part, they seem to want to practice their masochism more often, but actually find it difficult to meet potential partners. This by a study conducted by Benham. They may also make use of dominatrixes, which refers to a female who takes on the role of being dominant in sexual sadomasochistic scenarios in a professional sense, though they can actually charge excessive money. 1/3 of Benhamel's sample were actually men hiding the activities from their marital partners, another factor to consider as to what it means to be someone with the disorder. They suggested that BDSM clubs were the preferred places to meet their partners, and some actually reported having their own dungeon in their house or at a rented place. A lot of them felt that these activities actually added to their psychological stability, and many believe that it's actually a form of affection. You see, the person actually becomes the center of very intense attention, and some actually find it to just be a form of self-therapy. Sexual masochism disorder can actually present with various other disorders as well, such as other paraphilic disorders, so for example, transvestic fetishism, though a strong link has also been made between SMD and borderline personality disorder, with the study finding that it was 10 times more common in women with borderline personality disorder. Links have also been created with decreased libido, anorgasmia, sexual addiction, and dyspareunia. Lastly, there's also been links created with erectile dysfunction in men. So, where does all of this come from? Or when does it come from? Or even how does it come to exist in the first place? Well, there really is a number of different theories. Some suggest an intrinsic origin, in which case the person with SMD actually has it deeply rooted in their identity or personality, and it's done so throughout their entire life. Others suggest an extrinsic origin, suggesting that it's been developed through environmental processes. This includes pre-erotic childhood experiences and sexual arousal. Others suggest a psychodynamic or neurobiological perspective, saying that it's a self-destructive mechanism or a mechanism for emotional self-regulation. Others suggest, though, that it's a psychological adaptive mechanism to overcome abuse, specifically that related to childhood trauma from sexual, physical, or verbal abuse. The average age of onset is at about 19 years old, though the onset of fantasies was actually reported to be mainly during puberty or childhood years. So to continue the topic of who, what, why, where, and how, there's actually little known about the course, persistence, and the severity of this disorder. We know that there usually is a decreased libido with elderly age, but this is quite normal. Though masochistic-like fantasies or ideas were actually mostly reported to happen before people's first sexual experiences, most often during nursery or primary school. And fantasies from Bennemal's 2020 study were suggested to mainly be inspired by cultural factors such as movies or pornography. Some actually relate to various sensory experiences. So one of the participants from Bennemal's study suggested how he tried to place his penis inside of a fridge and was actually aroused by that. Furthermore, some links have been made between children being held down during play and how that might actually lead to SMD. Though the males that experienced abuse and now have SMD actually suggested that it took place during their first ever sexual experience. SMD can be found in both males and females, though it's actually the most common paraphilic interest in women. Genders respond similarly with regards to sexual arousal and sexual masochism, with Bennemal observing that females actually preferred using the word submissive, however, over masochistic to describe themselves, with males preferring masochistic over submissive. He suggests that this is likely due to the emphasis being placed on either the physical of the masochism or the psychological aspect of submissive. The masochist would therefore be more likely to seek physical pain, while the submissive would be more likely to seek to be belittled or humiliated. In some instances, however, the type of activity and the roles of submissive and dominant become more important than the gender of the partner, with attractiveness becoming less physical and much more psychological. With regards to cultural context, the actual cultural awareness of sadomasochism in general has actually increased quite a lot due to media such as 50 Shades of Grey. People started realizing that sadomasochism may be a way to express intimacy and one's sexuality. Though some believe that it turned perversion into something marketable. Though this was done through arousing interest in readers who wanted to know and experience feelings from the book. Though it's important to differentiate sexual interest from the disorder, because it's only disorder if it causes distress to the individual or significant impairment. Though social cultural views on sexuality and what classifies as distress may actually complicate this procedure. Cultural views on different couple dynamics and sexual myths are also factors to be taken into account. The problem is that these complications could actually cause a propagation of sexual violence, and it's extremely important to be able to discern between what counts as sexual masochistic activities and intimate partner violence, also called IPV. This especially in South Africa, where in total 26% of women in South Africa have reported experiencing IPV. Further knowledge of sexual masochism disorder in South Africa isn't currently available. Possible prevention strategies relate back to what causes it in the first place. So, people diagnosed with borderline personality disorder should seek treatment as it's a risk factor. Parents and institutions should avoid using things like corporal punishment, and abusive relationships should be avoided to the best of people's abilities, and that includes avoiding abusing other people or being aware of how you might be. Those with childhood trauma should seek therapy to try and resolve it. And people should be aware of their friend groups as well as their children's friend groups, because these might expose them to the practice. People should also be aware of how they are exposed to media, such as books like 50 Shades of Grey and the movies, as well as the exposure to pornography. Treatment for sexual dysfunctions is also encouraged instead of resorting to SMD-like activities to try and get sexual arousal. Sexual masochistic activities may provide joy and enhance bonding in some couples, though it unfortunately also has ties with IPV. This is characterized by a lack of pleasure in these activities as well as continuous fear outside of them. Those who do suffer from ASMD may also be expending excessive amounts of money, which could be affecting their family financially. This could be done on dungeons or for dominatrixes. People could also be hiding their activities from their families and living a secret life. I've been Louis Ubad, and thank you for listening to my presentation on sexual masochism disorder.